From Washington, D.C. studios, this is the Muslim News on Muslim Network TV. Assalamu alaikum, I'm Hena Zuberi. First, the headlines. U.S. sets new daily high for COVID-19 cases. Biden revokes travel bans on 8 African nations. Muslim youth robotics team gaining steam. Lawyers in India call for action over anti-Muslim hate speeches. Bank Islami Pakistan bags prestigious IRBA accolade as best Islamic bank. And our top story tonight. The U.S. records its highest single-day total of new COVID-19 cases on Tuesday. The nation hit over 400,000 infections, surpassing the previous daily record by a nearly 150,000. The grim milestone comes as the highly contagious Omicron variant spreads rapidly across the country. It has led to long lines at testing centers and a scarcity of rapid tests in stores. The Christmas holiday has also shuttered testing sites and likely contributed to testing backlogs. Meanwhile, workers' rights advocates are accusing the Center of Disease Control and Prevention, or CDC, of putting business interests ahead of public health. The CDC's latest guidelines, issued Monday, says asymptomatic people testing positive for COVID-19 require only 5 days of isolation. The government agency said they can resume normal activities after that while masked. U.S. President Joe Biden Tuesday revoked travel bans on 8 African countries, initially imposed due to the Omicron variant of COVID-19. He said those travel restrictions are no longer necessary to protect public health. Travel bans on Botswana, Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, and Zimbabwe will end December 31st. The U.S. identified its first case of the Omicron variant in California earlier this month. It has since spread to all 50 states and accounts for 59% of new COVID cases, CDC data shows. Robert Farouk Crane, former Deputy Director of the U.S. National Security Council in the Nixon administration, died December 12th at the age of 92. Crane also served as U.S. Ambassador to the United Arab Emirates in the Reagan administration. Crane converted to Islam in 1980 and became a prominent Muslim American scholar and activist fighting against Islamophobia after the 9/11 attacks. He wrote or co-wrote more than a dozen books, as well as over 50 scholarly articles on comparative legal systems, global strategy, and information management. From 1983 to 1986, Crane was the director of Dawah, or Outreach, at the Islamic Center of Washington. In 1986, he joined the International Institute of Islamic Thought as its director of publications. Crane was also the founding president of the Muslim American Bar Association. Authorities have identified a woman suspected of setting multiple fires at the Islamic Center of New Mexico a month ago. An arrest affidavit released Monday reveals the suspect's name as Isela Camarena. The fires were set intentionally on November 29th, causing thousands of dollars in damage, authorities said. Security camera footage shows the woman setting a trash can on fire, then pouring the burning trash on the ground and spreading it. A family member identified Camarena after seeing photos of the suspect. Nearly 15,000 Muslims attended the annual MAS-ICNA convention held earlier this week at McCormick Place in Chicago. It is one of the largest Islamic conventions in North America, jointly organized by the Muslim American Society and the Islamic Circle of North America. Over 500 volunteers helped organize programs during the 3-day convention. The event included hundreds of scholarly sessions, intensive workshops, roundtable discussions, art exhibitions, and film screenings. A Muslim youth robotics team called the Marvels hosted a regional STEM event this weekend at the MAS Islamic Center of Dallas. The event was part of a drive to encourage STEM achievements amongst Muslim students. Mohammed Ibieda, a research scientist at Sandia National Laboratories, coached the team, which was formed last July. Its goal is to engage Muslim youth in technology from a young age. This weekend's event was part of the first Tech Challenge, National Robotics competition. In it, middle and high school students go head-to-head creating and programming robots. Workers unearthed a copper box likely buried 130 years ago while dismantling the pedestal of Confederate general statue in Richmond, Virginia. It is the second apparent time capsule found there containing metal coins, letters, newspapers, and books amongst other items. According to a 1887 newspaper article, a time capsule hidden in the base of the statue of General Robert E. Lee contains relics. It included buttons, bullets, Confederate currency, maps, and a rare picture of assassinated President Abraham Lincoln in his coffin and other items. In international news today, a group of veteran lawyers in India is asking the country to take action over recent Hindutva events, where speakers called for the genocide of Muslims. The move comes as opposition party members question the silence of Prime Minister Narendra Modi on the issue. Muslims were openly targeted by Hindu leaders assembled for a 3-day religious assembly last week in Haridwar in Uttarakhand state. At a separate event in New Delhi on December 19th, Hindu leaders were seen attacking Muslims and taking an oath to die for and kill to make India a Hindu nation. The lawyers said that the events and speeches delivered were not mere hate speeches, but amount to an open call for murder of an entire community. Turkey rescued 526 asylum seekers pushed back into Turkish territorial waters by Greek forces over the past 12 days, authorities said. The Turkish Coast Guard Command said Tuesday that from December 13th to the 25th, in a total of 52 incidents, 991 irregular migrants and 10 migrant smugglers were apprehended. The statement also highlighted Turkey's efforts to prevent irregular migration, illegal activities, and to help anyone in peril at sea while respecting human rights and laws. The Coast Guard also expressed concern over rising casualties along migration routes. In addition, their statement said Greek security forces' tactics are forcing irregular migrants to change course directly to Italy. Chinese web users slammed billionaire Elon Musk Tuesday after Beijing said its space station took evasive action to avoid hitting 2 of its SpaceX satellites. Beijing submitted a document to the UN Space Agency this month. China claimed its Tiangong space station was forced to take preventative measures to avoid collision with SpaceX's Starlink satellites in July and October. Tiangong, which means Heavenly Palace, is part of China's bid to become a major space power. China has landed a rover on Mars and sent probes to the moon. Its core module entered orbit earlier this year, with the station expected to be fully operational by 2022. Bank Islami, Pakistan's leading Islamic financial institution, was named Islamic Bank of the Year for growth and strategy in Dubai earlier this week. It was one of the 2 coveted accolades it received at the 7th Annual Islamic Retail Banking Awards. The bank's president and CEO, Syed Amir Ali, was also honored as the Best Personality of the Year for a 2nd consecutive year. The international awards are a pinnacle of achievement for Sharia-compliant banking in Asia. They're organized by UK-based Cambridge IFN. Within the last 7 years, the awards have become a gold standard within the industry. Coming up next after the break is our in-depth analysis segment, which reports on highlights of racism, discrimination towards Muslim health professionals in the UK. So stay tuned and we'll be right back after these messages.
If I could be you, and you could be me for just 1 hour. If we could find a way to get inside each other's minds. Walk a mile in my shoes. Walk a mile in my shoes. Well, before you abuse, criticize, and accuse. Walk a mile in my shoes.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
Welcome back. In Muslim news, we shared the report which highlights racism, discrimination towards Muslim health professionals in the UK. To discuss this in detail, let's go to Imam Abdul Malik Mujahid. Over to you, Imam Mujahid.
It is very interesting. When the news started coming from the United Kingdom about the COVID a couple of years ago, it was that the first people who have died, first physicians trying to save the British life from the COVID-19 were Muslims. But now a report prepared by Muslim physicians in UK has come out. It says that Muslim physicians as well as other health professionals are actually discriminated against. We are honored to have the author of the report, herself a physician, and the chairwoman of the Muslim Doctor Association in UK, Dr. Hena Shahid.
Assalamu alaikum. Thank you so much for having me.
It's a very serious report, and it really, I was shocked to see that because I thought Muslims were in the forefront of helping people save lives. Now what I'm hearing is that they were in the forefront to die first and discriminated still. So what are your findings?
Unfortunately, you're absolutely right. And in your opening statement, you said, that reports came out in the UK that the first four doctors actually who died on the front line in serving in the National Health Service were in fact Muslim. And so we started doing some analysis, over the course of the first wave to see, what was going on in terms of the people's experiences on the front line. And what we found was that actually 50% of doctors who died in the UK, over 50% in fact, in the first wave were Muslim. And over 90% were ethnic minority. So, there's a huge, huge overrepresentation of Muslims and ethnic minority doctors dying from COVID-19. And there have been lots of reports looking at why ethnic minorities were disproportionately impacted, but there was nothing really to look at the experiences of Muslims in particular. And that's why we set about to do this report, to look at what some of those issues are that Muslim physicians face on the front line at work, which may make them more likely to die in COVID, but also to suffer the experiences of discrimination that we've actually been hearing for many years now amongst our Muslim colleagues, more likely to be bullied and harassed, more likely to face disciplinary sanctions at work, less likely to progress in their career or face significant obstacles. So these are some of the things that we've been hearing over the years. But unfortunately, it was COVID that really emphasized what impact this can have. People's lives can be lost when discrimination and Islamophobia are not tackled in the healthcare service.
That's so shocking. Let me hear from you. What I hear is the first four physicians who died were Muslims, and you're saying that 50% of all physicians who died trying to save lives were Muslim. Did I hear you correctly?
Yeah, that's correct. That's the analysis that we did for the first wave. Obviously, we have to be careful when we're interpreting the data, because actually the data that's available is not complete. But yes, our preliminary analysis has shown that over 50% of doctors who died on the front line were from a Muslim background.
And do you know what is the proportion of Muslim doctors in the system?
So the proportion of Muslim doctors in the National Healthcare Service is somewhere around 10 to 15%. Again, we have to interpret this number with some caution, because we know that in general, people who belong to faith backgrounds, and in particular Muslims, feel uncomfortable disclosing their religion when it comes to job applications, for example. So it may be that there are slightly more, a higher proportion, but certainly the number is 10 to 15%. maybe, it would be 15 to 20 maximum, but definitely not more than 20%. But yes, even if we look at that proportion, then over 50% is still a huge overrepresentation.
So sorry to hear about it. Thank God that they were there to save lives of other people while feeling the discrimination. Is this the feeling or the actual facts of discrimination? What type of discriminations are they facing?
So this is something that we looked at in the report. And if I go through some of our key findings, it might help contextualize what some of the issues are. So, for example, 9 in 10 Muslim healthcare professionals told us that they did not know any Muslims in leadership and management positions. And over 2/3 said that they cannot really identify any role models. So this creates this power asymmetry. Also, 4 in 10 had said that they had received verbal abuse from colleagues specifically around their faith. And 8 in 10 are likely to feel anxious when they hear any news around terrorism reported in the media, which creates this double jeopardy of feeling anxious around their personal safety. They reported feeling bias, experiencing bias at work from both colleagues and patients. Bias across their whole professional lives, which begins actually at medical school, and it's compounded across their career. And the very real impact that this has with Muslim healthcare professionals feeling that they're not good enough, feeling that they're constantly being judged, impacting their confidence, self-esteem. And about almost half of them have reported that they have thought about leaving their profession. So what this translates into is what some of the other findings were, that 2/3 don't actually feel comfortable raising concerns at work, and 4 in 10 have said that they've had to compromise on practicing their faith at work. And this creates a sense of moral injury and distress. And the majority of healthcare professionals in this report said that they had experienced othering and stereotype threat, not feeling that they belong. So what this means, and what we saw in COVID from the reports that we were getting, was that when they were put in frontline roles without adequate PPE, they did not feel confident enough to raise concerns to their seniors, because they never actually feel the sense of belonging in the healthcare in the health service, that they feel that actually that they're valued, and that they would feel that that their concerns would be taken seriously. This fear of being ridiculed, all of these led to people actually putting themselves at risk. And also what we heard was that they were put on the front line in higher risk roles where their non-Muslim colleagues were doing less frontline work. So really increasing exposure risk from COVID. But like I said, some of these experiences of discrimination, of bias, of prejudice actually predate COVID. But COVID just highlighted the cost that it can have in terms of lives that are lost unnecessarily and unfairly.
Dr. Hena Shahid, major report, I must say, about a major system. In United States, people refer to your healthcare system as something to learn from. And you're telling us what is going on in that system. Tell us how the British media covered your report.
Well, unfortunately, the mainstream British media didn't cover the report. We saw coverage more in, Muslim channels and by Muslim organizations, faith groups, and media outlets, but not the mainstream media. And this is really disappointing, because actually it shows the attitude that the mainstream media has around such a serious issue, that it's just not taken seriously. So this in itself raises a lot of questions around why this issue isn't achieving the attention that it warrants.
So if media did not cover, probably it did not reach the ears of your government either. What has been the response of the government?
Well, we haven't had any response from the government. And actually, we're yet to hear a response from NHS England, which is, and NHS employers, who are actually the people who make decisions around the healthcare system. So, we're yet to hear from them. What more can I say to that?
Well, it is very sorry to hear that a 20% at least, or something like that, of healthcare professionals are concerned about the work conditions, and neither government has responded nor media has thought it is important. That's a terrible situation, reflects badly on the British society and its relationship with its substantial minority. Tell us, what is the Muslim Doctors Association when it come into being? Does it have due-paying members? Because if 2/3 of the Muslim physicians don't want to air their grievances to their authorities or superiors, maybe the Muslim Doctors Association will organize enough to give them the backbone and the support which is needed.
So that's a really important question that you asked. So just to go back to the point that you made, like I said, 10 to 15% of healthcare professionals have declared that they come from a Muslim background. That is still a huge, a significant proportion of the workforce. And we have been raising issues around Islamophobia for a couple of years now, for a number of years, in fact, with the NHS, decision makers, people who employers, trusts, and it isn't something that is still taken seriously. And as you said, when people don't take it seriously, there isn't that support that is available for people who may be experiencing Islamophobia and discrimination. So Muslim Doctors Association is a voluntary run organization. We do this in our free time. We have day jobs, and we are looking into ways that we can provide a support service for our Muslim healthcare colleagues. And because we recognize that there isn't anything in the system that exists, there isn't anything in the NHS. Last year, actually, there was a faith-specific service, a counselling service that was opened for Muslim NHS workers, which was a positive step in the right direction to see this, kind of psycho-spiritual counselling being given. It's something that we've asked for a number of years. But the support needs to be mainstreamed. And certainly this is what some of the respondents told us in the survey and other research that we've done, is that, there isn't any formal support that is available in the healthcare service. Having said that, though, we are seeing some pilots that are being run in various parts of the country, looking at faith-specific interventions to support colleagues who come from a faith background. So to give you a bit of context, at the moment, what we have in the UK in the healthcare service is metrics or equality standards. So we have two standards at the moment. One is on race and one is on disability, because these are protected characteristics. And I go into protected characteristics in the report with my colleague. So there are 9 protected characteristics in the UK law. Religion is one of them, but it isn't something that's taken seriously. And so we've been campaigning for the need for faith equality standards that look at how people colleagues in the NHS who come from a faith background, what are their experiences, what are the support that they are given, and for this to be routinely embedded in the annual surveys that are collected from healthcare workers around their experiences at work. We don't see any information that's collected around religion. We are seeing information collected around ethnicity, also disability, but we need to expand this to religion, clearly in light of this report, which shows that this is a huge problem that Muslim healthcare professionals face. And I know that there are professionals from other faith backgrounds as well. So really we need to embed support for colleagues who come from a Muslim and other faith backgrounds, to get the support that they need.
Well, thank you so much, Dr. Hena Shahid. Dr. Hena Shahid is author of a major report, and I would say a groundbreaking report that 50% of all physicians who have died trying to save lives of British people were Muslims, but they are highly discriminated against. And Dr. Hena Shahid is also chairwoman of the Muslim Doctors Association in UK. Thank you so much, and Assalamu alaikum.
Walaikum salam.
Back to you, Hena.
Thank you so much, Imam Mujahid. That's all from our Washington studios tonight. Thank you for tuning in. You can find previous episodes and more on our YouTube or Facebook. For more content, keep watching Muslim Network TV or visit muslimnetwork.tv. Assalamu alaikum and good night.